Welcome to the EADV podcast, the official podcast of the European Academy of Dermatology and Venereology. I'm Adriana and I'm your host. Every month, the JEADV chooses and highlights 4 articles in a section called Editor's Picks, and today we explore the Editor's Picks for October 2024, selected by the JEADV Editor-in-Chief, Professor Carl Paul. Medical Complications of Tattoos, Prevention and Regulation, Looking Behind the Curtain, Onychoscopy of the Nail Unit, Melanoma in Adolescents and Young Adults, Increasing Incidence and Specific Features, and Atopic Dermatitis in Adults and Resistance to dupilumab, Searching for T-cell Clonality. But before we get into that, check out the 2024 programme of courses, as there are still seats available for genital dermatology and rare skin disorders. You can learn more at eadv.org. And now, the Editor's Picks. Article 1. Medical Complications of Tattoos, Prevention and Regulation. In this review from the EADV and Body Art Task Force, Gulbuddinjan and colleagues provide a comprehensive and well-organised overview of the possible complications of tattooing, including infections, granulomatous reactions, and allergic inflammatory reactions. Evidence behind tattoos remains complex yet under-researched. Moreover, product standardization and regulation are challenging, as tattoo inks are industrial products with many impurities and contaminants, including insoluble particles. Toxicological studies, particularly regarding risk of carcinogenicity, organ exposure, allergy and photosensitivity, and standardization of tattoo ink production with health regulatory assessment are warranted at both the European and global levels to ensure consumer safety. Article 2. Looking Behind the Curtain, Onychoscopy of the Nail Unit. Clinical diagnosis of nail unit lesions remains a challenge for most of us. In this systematic review, Slavinska et al. Present 19 studies including over 200 patients summarizing the clinical utility of intraoperative dermoscopy of the nail unit after nail plate avulsion. They suggest that this technique may help to better define the most appropriate surgical diagnostic procedure and may improve our diagnostic capabilities. Further prospective studies are needed to confirm these preliminary findings and to demonstrate the truth lying behind the nail plate. Article 3. Melanoma in Adolescents and Young Adults, Increasing Incidence and Specific Features. In this population-based cohort study, Buya et al. Provide insight into the epidemiology of melanoma in adolescent and young adults, describing the steady increase in melanoma incidence from 1990 to 2019. They also showed gender differences, with males having less advanced lesions and the trunk as the primary site, while women are affected on the lower limbs as the most common primary site. Such important elements could influence specific prevention campaigns for this population and may influence the fashion industry to cover sites most at risk with UV protective clothes. Article 4. Atopic Dermatitis in Adults and Resistance to dupilumab, Searching for T-cell Clonality. Diagnosing cutaneous T-cell lymphoma in adults may be challenging for dermatologists. Cook et al. Reviewed records of 46 patients who were non-responders to dupilumab. Among those re-evaluated, slightly over half, 54%, were diagnosed with cutaneous T-cell lymphoma. These findings suggest that we should consider skin biopsy and testing for T-cell clonality in patients who do not respond to dupilumab, as well as patients with atypical adult-onset atopic dermatitis. In the future, can lesion analysis with artificial intelligence aid the clinician's eye to differentiate between atopic dermatitis and cutaneous T-cell lymphoma? So to recap, our first editor's pick was Lessons Learned in a Decade, Medical Toxicological View of Tattooing by Gulbuddinjan and co-authors. Our second editor's pick was Intraoperative Dermoscopy of the Nail Unit, a Systematic Review by Slavinska and co-authors. Our third editor's pick was Cutaneous Melanoma in Adolescents and Young Adults by Buja and co-authors. Our fourth editor's pick was Detecting T-cell receptor clonality in patients with severe atopic dermatitis refractory to dupilumab by Cook and co-authors. As you know, all of the research presented today can be found in the Journal of the European Academy of Dermatology and Venereology, and although you can find free access and open access articles, EADV members benefit greatly by having access to all of the articles and content. A special thank you to all of our listeners. If you haven't already, make sure you subscribe on Apple Podcasts, follow us on Spotify, or you can find us on any major podcast provider. It really supports our channel. And we appreciate you joining us and look forward to presenting more interviews, research, and topics of merit. Until the next episode, take care of your skin.